Hello everyone, this is Dr. Valerie Mukanga with Healing Wings Dental. This is the place where we treat your smile as if it is our own. And so April is the month of oral cancer awareness. But before we actually dive into the subject, we're going to go through some statistics. So according to the World Health Organization, worldwide, there is about 350,000 cases of oral cancer every year. And as far as death, there are about 175,000 deaths every year. Now, when we come to the US, in the US, about 54,000 new cases are diagnosed of oral cancer or oropharyngeal cancer. That's yearly. And as far as deaths are concerned, about 11,000 deaths annually. And so it's something that we should take heed about, right? And so now talking about oral cancer, what is it? And it's cancer that is found in your oral cavity or in your mouth and also in your throat. So it can be found on your lips. You can find it on your tongue, on your cheeks, in the floor of your mouth. The floor of your mouth is that area of your mouth that is right under your tongue. So when you lift your tongue up, that area down there, that's the floor of the mouth, and also on the roof of your mouth. So the roof of your mouth is the palate, right? And you can find cancer there. Also in your throat, as we said. And now, what does it look like? How does oral cancer actually present? And it presents in many different ways. You can find some white patches in your mouth, or maybe red patches also in your mouth, or some raised area, like some swelling, some lumps in your mouth as well. Or it can also present or show up as some non-healing area. So you can have some non-healing ulcers. It's there. So that's how some of the ways that oral cancer can present. So let's say that you are looking for oral cancer in your mouth. What are some of the signs that you should watch for? So as we said, if you see that you have some sores in your mouth and after about 2 weeks, they're still not healing, you definitely want to take heed, because the mouth is actually one area in our entire body where sores heal really, really, really fast. So if, the soreness is not really healing, it's about 2 weeks after and is still there, you definitely want to go and get checked. If you see some white patches in your mouth, some red patches in your mouth, you want to also take heed. Some lumps, some thick areas, you also want to seek help. If you have difficulty swallowing, definitely seek help. Or also if you feel some numbness in your mouth, you definitely want to seek help, okay? And so what are some of the risk factors for oral cancer? There are many risk factors, and we're going to talk about a few today. Tobacco. Tobacco is one of the major risk factors for oral cancer. And so that will be cigarettes, that would be pipes, that would be cigars. Sometimes cigars may seem very entertaining, relaxing, and all of that, but it can actually lead to oral cancer. It's one of the major factors as well. And so what about e-cigarettes? E-cigarettes are very new. There's not too much research yet to actually lead directly or correlate oral cancer directly to cigarettes. However, there is in the vape, and vaping as well, some harmful chemicals that are produced, that is definitely harmful for your mouth. So you want to also take heed. Besides tobacco, also alcohol. Alcohol can lead to oral cancer. HPV. HPV is human papillomavirus and has a very strong correlation between HPV and oral cancer. And so when it comes to HPV, you can contract HPV through vaginal sex or anal sex or also oral sex, right? And so it's very important to be mindful of that. Sun exposure also. Sun exposure can lead to oral cancer, especially in the lips, okay? So those are some of the risk factors. So the thing is, it's a good thing, yet it's a bad thing, is that oral cancer can often occur to where you have no pain at all. I say it's a good thing because you don't have pain, but it's also a bad thing because you don't know that you have it, actually growing in your mouth. So you need to be very careful. How is it diagnosed? You would actually want to go to a dentist, for instance, and we will do oral cancer screening. So we check in your mouth to see if there are any lumps, any sores, any patches in your mouth. And then we would actually take a diagnosis, a biopsy, and send it to a pathologist. And then, it's going to tissue that were biopsied will be evaluated, and then a diagnosis will be rendered to you. Because not every sores are cancerous, not every patches are cancerous, but that's why we need to do a biopsy and diagnose it and then give you the report. Okay. So that is how oral cancer is diagnosed. So the key point here is to understand that it's very important to get evaluated. Whether you go to the physician or also to a dentist, an exam is going to be done in your mouth and then evaluated accordingly. Many times, when you come to the dentist, an oral cancer screening will be rendered, where we actually palpate your tongue, we palpate your cheeks, we palpate and try to see if there are any lumps. We look and see if there are any pouches, and then we are able to help you accordingly. Okay. So now, the prevalence of oral cancer increases when you're above 40 years old and such. In fact, it also affects men more times, about 2 times more than women. But nowadays we see more young people with oral cancer because of the prevalence of HPV. So it is very important for you to be mindful of your sexual activities. Okay. Now, we are Healing Wings Dental, and if you are concerned or if you want to see, if you see some patches, you can come to us and we'll actually definitely do an evaluation. If you have a doctor on your own, you want to definitely do that so that you don't end up becoming part of the statistics, especially because the earlier the oral cancer is evaluated or oropharyngeal cancer is evaluated, diagnosed, then your outcome as far as overcoming or seeking treatment for the condition has a greater success rate, about 80 to 90%, okay, of healing rate. However, if it's detected late, there's only a 5% survival. So just like anything, early prevention is always the best. Okay. So that's what we wanted to talk to you about today. If you have found this information to be helpful to you, please do not hesitate to share it with your friends, with your family, your coworkers, whoever you know, so that they don't end up falling prey of oral cancer. Okay. And if you are in need of our address, we are Healing Wings Dental, located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. And our phone number is 972-213-0202. Please do not hesitate to give us a ring. We will be glad to become part of your journey to help you not only with oral cancer or potential oral cancer, but also with all your dental needs. Okay. So until we see you next time, you be blessed. Bye.